Yeah, that's one powerful elbow, though. Gee. Yeah, that's half the body just wants to run away from you, but I'm laying down.
There we go, yes.
That move.
Yeah, you're doing good.
People haven't been able to get that one at all.
Six years ago, car accident?
Oh, 4 years ago.
4 years ago, car
My
accident.
handwriting.
You're fine, you're fine. So 4 years ago, car accident. Tell me about that and then what you felt.
Yeah, I was just taking a left turn, driving in St. Petersburg, and an older gentleman blew a red light and T-boned the vehicle, right? Yeah.
Okay.
I just remember kind of feeling, if I recall correctly, it was a neck stiffness on the right side,
Okay.
and then it was followed by anxiety. I was all shaken up. They took me to the hospital because I was not too functional.
Yeah.
And since then, the pain has not really gone away.
So where were the disc injuries? Lower neck, lower back, or do you remember?
Both. There's, I believe, 3 or 4 in the cervical
Okay.
and 2 in the lumbar.
So it takes a minimum of 10 to 15 years to get a disc to bulge. So absolutely the whiplash, pushes it over the edge. But the reality, when they took healthy discs out of cadavers and they subjected them to thousands of pounds of force, they don't herniate, they don't bulge.
Okay.
That there has to be a prior injury, generally 10, 15 years prior. So you're 26 now, 22 when the injury happened.
Mm-hmm.
So we're looking back at like 10.
Okay.
You understand? For the actual source of what caused the injury to the end plate. So the disc actually contacts this bone here, and then when the bone gets injured from a compressive force, there's acid that gets released that liquefies the disc and then makes it injurable during a car accident.
Right.
Yep, let me feel the hips here for a second.
In the hip, I've been told are fine, but feels like I'm dragging my left side when I walk. So.
Hips are not too unlevel. The main thing I'm seeing is a torso shift. Your torso's not on straight. Well, your body, when we have injuries, will try to find a position of comfort. Head's a little forward. We're going to see it's really a head tilt. So when you have an injury to one side of your neck, and I think it's the right side,
Yes.
your head will tilt left, and then you can't walk around with your eyes tilted, so you'll drop your shoulder to right your eyes. But it's really a neck misalignment, neck injury causing a shoulder tilt.
Okay.
And then it'll cause essentially the left lower part of your neck to overwork. Because we're in right avoidance, the left lower is going to overwork. How about just looking up? If you just look up, is it
That's
a lot of pain?
one of the worst ones, yes.
All right. And
I
that's,
can't look up, so.
gotcha. And that's how long do you think that's been going on?
I think the full duration,
Since-
the 4 years, it just gotten worse as I had to relearn how to turn my head because I was doing this for a while. And once that cleared up, it's been,
Do you think you sleep on your belly?
I try not to, but I
Good.
wake up that way.
Yeah, probably head left. Yeah.
Yep.
All right.
I have a, oh, sorry.
No, you're fine, you're fine.
I have a funny one for you.
Yeah.
I think I've heard a client of yours say this before. I got an insert to offset the
Yeah,
whole left toe
throw it away.
balance.
Throw it away.
I did. You said I had a leg length discrepancy.
What you have is domino effect from your neck. That your body is going to create domino effects. So this is going to cause this, which will cause this. Do you understand? Just
Sorry.
Is it right? This pain? Well, tell me.
I'm just a little bit stressed about, I just had to
I got you.
drive, so it's so much worse at the moment. Because the last time I was adjusted, I ended up being bedridden for about 2 weeks, and it
All right.
got
Well,
worse.
the goal with any adjustment is to not adjust the parts that are injured. So ultimately, the long-term health of your spine is going to come from those discs. That's why we take pictures and MRIs of them, because the discs are the non-sensitive spacers that prevent the nerves from being hit. The sensation down into your shoulder, that's the nerves that come out of your lower neck. So the nerves exiting the lower neck go down your arm. The joints will refer pain in between your shoulder blades. But the upper neck is ultimately the main engine of your spine. And if the upper neck is not doing what it's supposed to be doing, the lower neck will overwork, and those pains that you're that uncomfortable, just something doesn't feel right, Ed, and please help me get rid of it. Air out, I got you. Yeah, you're frozen here, but I got you. Breathe. I got you. It's okay. Exhale. Let your chest relax. Let your chest relax. I got you. There you go.
That was crunchy.
Yeah, you're good. Deep breath. We'll get you moving. Exhale. There you go. Let the chest relax. Yeah. Yeah. I got you, bud. I got you. Easy, easy. All right, good. That's that for me. I got you. There we go. with that adjustment, we're not trying to pop every joint. My goal, what are you doing here? I'm trying to loosen up the sacroiliac joint. The joint in the glute can take stress off the lower back joints. It's a very powerful joint. And just, I'm going to show you what I don't want just in case you're out of town or somebody else works out. Nobody should ever contact your lower back and be pushing with an adjustment into your lower back. Above, up here, good, and down in the glute, good also, because we're trying to loosen up the areas around the lower back. But please be careful. You know, if somebody sets up like this and their hand is in your lower back, do you understand?
That's been every single one of my adjustments, I feel like.
Yeah. So right, breathe for me. I got you, bud. Go easy. Get the idea. We're not trying to body slam, because I want to just move that joint without moving the lower back, with the understanding that it's going to move a little bit. You understand? I can't not move a little bit, but we definitely can lessen the amount of movement and balance it.
Right.
All right, face money back for me.
They did PRP. I was told not to get adjusted for a period of a month or two if I'm able to, and I'd refer this information to the chiropractor. And I recall he grabbed my head and put me in a really odd kind of outward position and snapped it the opposite way, and I felt a dull ache for about a month or two following.
You have injuries in your lower neck, and if a chiropractor unfortunately goes in there and moves the areas that are injured, it's like having a cut on your skin. If you have a cut on your skin and somebody goes there and plays with it, it's making it worse. We need to not continue aggravating the parts of your spine that are injured. And here it is. Wow. Yeah. Hello. This knot right here?
Yeah, that's been there.
Correct. That's what needs to be corrected. It's sticking out like a Frankenstein bolt. I'll level it for you. I'll show you where the bones are level. Right about there. Do you understand? Now I got level bones, but I got your head 15 degrees off to the right. Do you understand?
Right.
That's how much, like a bicycle with your handlebars crooked to make the tire straight, right? Your handlebars should be level with the tire. Okay. And this needs to be loosened up, and the goal is to, again, loosen and adjust this vertebrae without moving the injured or the more injured discs in the lower neck.
Okay.
I got you, bud. I got you. Not gonna hurt you. I go real easy, real gentle. It's okay. I got you. Yeah. Yeah, it's way too tight up there. But get the idea. We're just trying to loosen the top guy. Chin up. Yeah.
Yeah, I'm trying not to flex up on you so you can't adjust, but
You're fine. The upper neck is going to be uncomfortable as we balance your spine and restore the function of your upper neck. But what will happen is as we clean this area that's been clogged up, the lower neck will get on vacation, and overall your spine will work better as a team and not just have uneven work happening.
yeah, I decided I'm going to come here when I started watching the videos and I got more information
I'm
from
glad
your
you're here.
half-hour clips than I ever did from visiting a professional in my local area.
I'm so happy you're here, bud. I'm so sorry that, this information that I have didn't ultimately come from my own. It came from my father, who struggled to figure out how to take care of his own back problems. And then the journey that he had to take to find relief, he then taught us, my sister, my brother, myself. And he didn't have anybody be serious with him before he was a chiropractor. And now he's super serious with people. And just, he didn't have anybody caring for him. And so he's had to kind of create a distillation of all the things that didn't work he threw away, and all the things that worked now we've kept. And I think that's what we've accomplished here, is that we try to only do the things that have helped people. What's been proven to help, thousands of other patients.
Which, weirdly enough, you might have any information on this, but doing a TENS unit made me worse almost 9 times out of 10. I don't remember getting relief from it. So.
Yeah. I don't subscribe. I don't. It's supposed to be a nerve distraction. You're trying to place it. We call it the gate theory. There's only so much nerve sensation that the brain can handle, processing at any one time. And so you flood the brain with other nerve signals so it can't handle the pain signals. Does that make sense? That's essentially what you're trying to do. So none of it is, directly dealing with the cause for why the original nerves are upset. If anything, it allows people to continue stressing out the areas that are injured. So we're only making those injured areas worse.
Right.
So how are we
temporarily distracting them and
right? How are we going to get to a better place? I don't see how this is going to accomplish the goals that I have. I have a couple goals here. I want your upper neck loose. and I want the upper neck to start being okay, being closer to being curved. Ultimately, your spine, for it to make it to 80, 90 years old, we have to have the right alignment. Orthodontists teach that the teeth need to be aligned up in a certain way for longevity, and in the same way your spine needs to have the proper alignment for it to make it to 90. And our world and our lives and computers and phones just take away our alignment. It's easy to spend our first 20 years in school, rounded forward, and then careers and computers and stuff like that. And so there is no education about alignment. We're left to just wait till we feel things, when I think I told you that half the spine doesn't have any feeling.
Right.
And so it's easy to throw the work to the non-sensitive areas, and the sensitive parts of your spine just be avoided until they become so damaged and injured that now they can't be avoided anymore. So confrontation is what I teach. Time to turn around and face the problems that are growing, because they're not going to get better without confronting them. Let's try to redirect the traffic away from the area. It's like if part of your roads were damaged with potholes, my treatment is to divert the traffic to non-damaged areas while we repair the areas that are damaged. Because you can't really repair a road while you're driving on it, right? So you have to divert the traffic first. And with the spinal column, the upper neck is supposed to be your main engine, and with how tight and how misaligned it is, it tells me that it's not doing what it's supposed to be doing. And because of that, now we have pains in these backup areas. And we'll fix you, bud. It's okay.
Well, appreciate
You're in the right place. It's just a matter of we have to slowly start getting your neck. I know it's uncomfortable. If this felt natural, you wouldn't need to be here.
Right, I assumed as much.
Yeah, if this felt natural, your the disc wouldn't be injured. And this is what I was going back to when you were 10 or 11. Something happened that threw your alignment out of whack, that then made the injury at 22 dangerous, right? More impactful to those discs, because the alignment was already putting more stress on those areas, and then now you had an event happen that then really tested them, and that's what then further injured the disc. So, they're not even teaching people how disc health, like I say, healthy discs don't herniate. You have to be set up for it. Yeah. I mean, even look at his feet. Don't move. Look how his left foot's turned out. Right? So your default, if you look down at your feet, your right foot's about 45 degrees, your left foot's almost completely, that's a piriformis contraction in your glute. And when we have nerve irritation in the lower back, you're going to get some tasering. You're sending some electrical activity going to that muscle, causing it to contract, not because you told it to, but because there's a disc hitting a nerve. And so that contraction is then going to be evident when you're walking, because you're not going to be able to relax it. And then piriformis stretching isn't the answer either, because how do you stretch a muscle that's being tasered? Right? It's not. We have to first release the thing that's causing the contraction. Then maybe we can go in there and work on the piriformis. Only after the pressure has been relieved, and that sometimes needs to happen. You need to go in there and then release the piriformis. But first, we need to figure out how much of that contraction is happening because of the lower back. Relax here, relax. Relax right here. Let it go. There we go. Yes.
That move.
Yeah. You're doing good.
People haven't been able to get that one at all.
I don't think so.
Now, if you don't mind me asking,
please.
At the bottom of the trapezius right there, where there's a knot on
Yeah.
both sides, you
Yes.
said that was the rib, actually?
First
Or-
rib right here. This is the rib. Yep.
That is the rib.
Yes, sir. Yeah.
Oh.
The muscle is being elevated by the rib. So ultimately, it's the muscle on top, but under the hard thing that you feel there, that's the rib.
Oh, okay. Then I guess I've been putting one of those tennis balls right against that rib, just jabbing it every.
Sure, it's not necessarily a bad thing. We're trying to push that rib down. I mean, you're trying to open up the channel that the wires that go to your shoulder and down your arm have to travel through that channel. I understand why what you're trying to. You kind of instinctively know this thing needs to go down.
Yeah, I was hoping it's not the bad idea of self-medicating where you're like, you've been messing yourself up for.
No, it won't be changeable with just that. The only way for it to not keep happening is to get the head back and the curve back in your neck. Forward head posture and loss of cervical curve is what creates it. So just working on this independently won't do anything. Makes sense?
Yes.
This can only be beneficial with the intent of making the spine supple so that the stretching that I show you at the end can change it.
I don't even know what's happening, but I can tell that something's off right there.
Yes, sir. Yeah. It'll cause anxiety, like you were saying earlier. The inflammation of this area is essentially what we call your sympathetic nervous system, and so your fight or flight system.
Yeah.
What'll make you it'll change your blood pressure, change your heart rate. When you're irritating these nerves, they send signals that can make you feel panicky or, this is the.
Yeah, unfortunately, when the pain shows up, that's when it starts happening. So on the way here, I had to
Sure.
do some deep breathing and
Sure, yeah.
meditation videos.
Right, well, deep breathing stimulates the parasympathetic, right? So your vagus nerve is stimulated by that deep breathing. So that's the brake pedal to your heart. So the nervous system here being inflamed irritates the gas pedal, and then you've learned to tap into your brake pedal to balance it. Now, if we don't stop further and excessive pressure on that gas pedal, the vagus nerve can only balance so much. So ultimately, you're catching this early enough that we're not going to let it get out of hand to a place where then people need to take medication to balance it, right? They have to take a pill to stimulate their vagus nerve because they're not able to just do it by breathing or meditation, or they have to medications to stimulate the nerve. And that's what essentially blood pressure medication is a drug that stimulates your vagus nerve and calms your heart down. If everything that you were born with is still in here and nothing's been cut out or removed or a rod's been put in, does that make sense?
Yes.
Then everything can be aligned. Nobody's removed any chapters of the book. Everything's still in here. Just needs to be reorganized. There's a big mark right there. It's hard to see, but see that, Garland? This is actually pretty locked on the left too. It's not just the right's locked. There's definitely inflammation throughout the neck.
Yeah, I believe they mentioned on the MRI that the protrusion of the disc is to the left side. So I was always wondering why the pain is on the right. I'm assuming just the body trying to adjust itself to a better position.
Right. Well, your body, like I said, you might be avoiding one side, and it causes abuse, and then that causes another domino effect. It kind of chains its way down your spine.
Mm-hmm.
Your spinal cord ends right here at L1. We call it the conus medullaris, and so the spinal cord kind of bulges right here, and then individual cables form off the end of the spinal cord called the cauda equina. Anyway, and so the nerve essentially that comes out here, so it travels down the cord and then it exits down here at L5. It actually starts up here, and so essentially, I believe that one of the first ways that the sciatic nerve can actually be irritated is up here in the middle lumbar, where the nerves that form the sciatic nerve originate off the bottom of the spinal cord.
Okay.
For instance, the nerves that come off at T6 up here form at T6. The nerve that comes off at C5 forms at C5, but the L5 nerve forms up here at L1 at the end of the spinal cord. And I've never had anybody really talk about that significance, but just kind of instinctively while working on my father, I found that, two things happen. You're loosening up an area that's not injured mechanically, the joints up here, but you're also alleviating one of the first places that the sciatic nerve can be pressured. The nerves essentially that go to your piriformis, you understand, they start right here.
I was speaking to a buddy of mine who's very skeptical about chiropractors, and I'd shown him, hey, but I'm going to see this guy, and he puts his videos out on the internet, so I'm assuming he's very confident in what he's doing. Otherwise, you would want to almost be behind in your office.
Right.
And within 3 minutes, he said, this guy has done more to this one guy. I think it was a guy in his mid-30s with thoracic outlet syndrome.
I got you. You got it.
I said, he's done more for him in 3 minutes than I've had done to me by chiropractors my whole life.
No, that's
So
humbling. I hope I can help everybody. It's my goal is give everybody everything I can give. It's all I can give.
Just one elbow?
Well, both elbows, but yes. There we go. All right.
And have you had cupping or the gua sha done before?
I've only had cupping done, and that's this area right here is
Real sore, yeah.
Yeah.
You don't have to talk.
I got you good. I'm glad you had a little soft tissue work done.
Yeah, I've had cupping very recently. The physical therapy office I go to, they haven't really been able to work with me because just about anything inflames the right shoulder.
Gotcha.
So they've just been doing what you did at the beginning of the meeting where they try and get curvature in the neck.
Gotcha.
And cupping.
Okay.
That's been my visits.
Okay.
So
Okay.
very conservative.
Yeah, we want to first. This is the nerves that go to your heart. This is anxiety right here. This is your cardiopulmonary nerve is the nerves that, 4 nerve roots here that form the main heart nerve, the sympathetic nerve to your heart. And so this is a high anxiety area right here. And
That makes a lot of sense. I was always the happy-go-lucky until...
we can restore it. We can
I
bring it back.
appreciate it.
This is again, I go back to, remember who you are. Daggone Mufasa. Yes, okay, fine.
A lot of the treatments I've gotten, the takeaway was that my discs are injured. I'll probably always be experiencing pain, but let's try and work around it until I can't bear it anymore and I get surgery.
Okay.
So it's almost like they presented it as imminent, just a question of how long can I bear the pain for the time being.
That's a very low bar.
Yeah. So what made it worse, and honestly, it was probably for the best because that turned me away from surgery. Is the initial surgeon said I'm so young, I'll probably experience even more pain later on in life from the scar tissue.
You know, you're 26. Let's say you have some 50-year-olds. Do you understand? When I look at your MRI, I see some discs that look like they're 50. Now, if we stay on this path, by the time you're 45, 50, if we don't change the alignment, they're going to look 90. Right? And by the time they start looking 90, they're going to want to operate on you. You understand? At some later point. If we don't change the mobility and alignment that you're in, if you continue on this path, then that's what they're essentially saying, that it's inevitable. But what happens if we change the alignment? What happens if we change which teeth that we're chewing on? If we stop chewing on the teeth that are injured, they're not going to keep aging at the same rate that they're aging. Right. And that has to happen. Now, they might not know how to do that, and so therefore they're not going to speak to something that they can't affect. But that's what I do. You know, we're going to change where you're chewing, change where you're bending, change which parts of your back are the main engines and the main, let's say, drivers of your spine, and stop depending on your backup areas, your lower back, your lower neck, to be the main parts of your spine that are working. And so that's where the hope and, say, just confidence that I have in being able to help people is that every MRI I've ever looked at, I see areas that are younger than the patient and I see areas that are older than the patient. And yet the medical and chiropractic world acts as if it's just wear and tear and aging that causes arthritis. And I go, well, how old are the whole spine is the same age. So to say that it's aging that causes it is nonsense. It's the alignment and mobility that you're in that creates the mechanical imbalance. And so they don't even have the right narrative.
Which that would be the biggest takeaway for me is I've been trying to get on the right track by myself. It's just been hard figuring out if I turn my head to get some mobility out of it, it causes pain. So
yeah, no.
It's almost
See,
like,
you're
what
only
do I do?
Well, right, you can't, right? Because right now, any exercises you do before today's visit, all the motion primarily was happening in your lower neck, and you're just further injuring it. Like earlier when I asked you to turn your neck, that was hurting both turning left and right because the lower neck was hypermobile. And so we want to take a step back, unlock the areas that are around the lower neck, and then give the lower neck a vacation, restore the function to the young parts that are not injured. Not to say that those other areas are just going to leap for joy when I tell them to function. They might be sore. And so there's a process of restoration to get an area moving that's been frozen, to figure out what happened at 10 years old that made it stiffen up so much that by 22 we had all these injuries. You understand? Okay, but I know it's intense. I know nobody's dug in here hard. Nobody's really gone in here and tried to clean this.
Yeah, that's one powerful elbow, though. Jeez. What's bizarre to me is every area you've gone over is where I hold so much tension and pain.
There you go. That's the cause. Yeah.
So is this right here the rhomboid?
So the joints in the lower neck will refer pain here too, and then yes, the rhomboids are in here, so you kind of have a couple overlaps. The ribs are elevated here, so you have the rib joints underneath the rhomboids that are elevated, so you have kind of three things going on. But yes, the roots of your neck attaching here. So the more forward the head goes, the more these roots get inflamed. Kind of like anchor points.
Because yeah, that's really where the pain is. It goes from the base of the skull down to
Correct.
what I assumed was just the scapula as a muscle,
Right.
and down the trapezius.
Yep. These are the roots, but ultimately you can rub them forever and ever if you don't get the ear back over the shoulder, if you don't reduce the forward head posture, if you don't get the chest, the head over the chest, then it's just silly. So all of this is prep. I'm prepping you for stretching
Mhm.
because it's stretching that changes posture. That took 100 years for chiropractors, and some don't even understand it, but that's ultimately the only way I've seen it change is we have to counter stretch, and we have to ask for more in the opposite direction than you are in a forward direction. So if you're 1 inch forward, we have to ask for 2 inches back. Does it make sense to balance
Yeah,
it?
opening up the front of the body essentially.
I think it's
the pecs.
Right, they say you have to double whatever the misalignment forward is. You need to double it in the reverse. Now we don't do that the first time we get on it,
Right.
but that's the goal, is to ask for double to undo and unlock and balance the spine.
Well, if you don't mind me asking then,
Please.
as far as, I forget what the cervical traction little
Yeah.
foam piece that you sell is. Is
Deneral.
that Deneral?
General, yeah.
Yeah, I was
Mhm.
given one from Amazon by a chiropractor,
Mhm.
and I was told to use it no more than 4 to 5 minutes, but I didn't seem to get any relief unless
Mhm.
I was using it for at least 10 to 20 minutes and
Yeah, I
more than
don't-
once a day.
They make off-brand ones that, what happens is the ones that you usually can buy without a chiropractor is, they're a little bit more mild. I'll show you what I have here and you can compare. But no, the ligaments take 20 minutes to stretch, so you don't have any permanent change until you're getting to 20 minutes. Now, many times at the beginning, if we're going to be milder about it, we might only tell a person to lay on it for 3 minutes. You understand? To work their way up to 20 minutes. But I'm a pretty greedy chiropractor, and I kind of want people right at 20 minutes at the get-go, and let's get it done.
Oh, I'm
Yeah.
glad to hear that.
But
because-
yes, even the instructions that come with it say to start at a smaller amount of time and work your way up. But that's, to me, based on the mobility. If I feel like your neck moved properly, we go right to 20. If I don't think you're ready, I wouldn't even give it to you, and we just do more visits until you're ready to do 20 minutes. You
Oh,
know.
if I told you what I did, you would probably whack me right now with that elbow. I wasn't able to get my head into I'm assuming the neck was locked up using
Uh-huh.
my cervical traction, so I almost applied pressure onto the forehead to try and get some movement
That's
out of
fine.
it.
That's fine. I mean, assuming you're not bending too much in the lower neck, assuming its placement is correct. So the difficulty is that the lower neck being loose, the device will sometimes want to slide down to the loosest part.
Yeah.
And I worry that we might further loosen what's already loose. So we want to keep it where it's stiff and where it's not bending to make it bend in a new place. So the answer is that is a good thing if it's in the right position, right?
Okay.
You understand?
Yeah.
And I have to show or just validate that and make sure that it could hurt you if it's in the wrong position. They are, at the very least, the Deneral device is a very powerful device and has the power to help you. But it's like a butcher's knife. You can cut onions or you can hurt somebody. These are tools. It's like a hammer. It's a powerful tool. If it has the power to change your alignment, but it also has the power to hurt you if used improperly.
Which makes so much sense. It seemed like it always tried to roll down
Down to your lower
onto
neck.
the areas that did want to turn.
Right. It's the valley. It's the valley of your lower neck, and that's partly why I spend a couple hours prepping people so that we create new folds. Try to let your chin go up a little bit, just a little bit, just effort.
That's right.
If it's too uncomfortable, you can put the chin back down. But you see, I want you to start practicing letting it be okay. That makes sense that your neck has a
Yeah.
little curve to it.
That's what I've been trying to do on my own. I'm glad you're telling me this because I just really don't know what's right and what's not. I figured the neck needs to be in this position, but I'm just so uncomfortable getting it.
Assuming that you're bending evenly, it's a good thing. It can hurt people if they're only bending in the lower neck, right? So it's good that you're cautious. Because
I'm sorry.
go ahead, please, yeah.
Being here, I get some pressure on the right side
Uh-huh.
at the base of the skull, so I don't know if that means.
Up here.
Yes.
Yeah, it's okay.
Okay.
It's trying to bend up there. The fact that you feel it means that it's moving.
Oh, okay.
And if it was totally locked, you wouldn't feel anything when you bring your chin up. It's an area that's been frozen that I beat up a little bit and is probably trying to move a little bit more up there. And I don't want it to, if it hurts in the lower neck, then you'd have to back off. I don't want to piss off and upset the lower neck more.
No, surprisingly, it's almost always in that spot when I try to get some curvature into the neck.
Yeah, it's that
But
old injury. Yeah, okay.
after some time, it just gets more of a sharp pain, and that's when I go
Gotcha.
back and
And
say
then-
maybe I should round out a little bit.
Then
and-
back off a little bit. Yep. It's just a knuckle joint that's inflamed.
Mhm.
You're not hurting anything really. If it hurts up there, it's just the joints are loaded with pain fibers, so they're gonna really, if they're inflamed or sore, and then you compress them, they're gonna
Yeah, you're gonna know.
right. They're gonna communicate with you. And like I was saying earlier, the back side of your spine has a lot of feeling, and so that's why people round forward to run away from it.
Now, this might be an odd one, but
Please.
do you recommend that I just entirely avoid the gym while I'm doing this right here? Because I've been off for about 4 years, and
Mhm.
very recently I was told by my physical therapist it's probably okay to get back into it.
What's your
I used,
cardio or your weights or what?
I used to do some powerlifting, but now I just want to stick to low weight. I just like to not look like how I do presently.
The main thing with lifting weights is, again, mechanically, you're only going to bend where you're loose. And so if we have your whole spine working as a team, then we're in a much safer place to do those things. But the ability to hurt yourself is high if you only have certain sections of your back doing most of the mechanical movement.
Right.
So we want to first, have a good adjustment of your spine, meaning that all the parts move willingly and easily, and then have fun. Go do what you want to do.
Right.
But I would at least get through a period of visits where we can, get your back moving properly, have you stretching, and the stretching not be agonizing, kind of idea. And at that point, we now know that your spine's working as a team, and now you can go have fun, and go exercise or whatever.
So kind of resume what I've been doing.
But right now, you can go right to elliptical. You can go do cardio stuff right now.
Okay.
You don't need to wait for that. But if you're going to talk about more strenuous things, then I would wait till we get your spine a little healthier first.
Yeah, I've been avoiding the gym mostly for the last 4 years. As far as walking, I think I was mentioning to you that the 1 foot just feels a little bit like dead weight on occasions. So I try to do cardio with walking. I've got 2 German Shepherds. I occasionally will take on 3 or 4 mile walks.
Yes.
And my one issue is that by the time I'm done, the hip is snapping so bad that I assume that's also counterproductive.
Yeah, the hips are snapping because the alignment that you're in when you're walking. So it's because of the piriformis contraction, because your foot is flared, then the muscles that attach to the greater trochanter are just rubbing over the bone as you're moving. We have to alleviate the alignment's wrong. Woohoo!
Oh yeah, that's the worst one so far.
This is the piriformis in here. Down. This glute medius actually specifically right here, glute medius, but we're going to get down to piriformis.
And this is still half force, huh?
This is no force practically.
Well,
This is me borderline petting you.
oh no, that's not good.
Real force is like about here.
Yeah, I'm trying to itch away from you at that point.
It's okay. It's a hard area.
We'll fix you, but I'm not here to just beat you up and overwhelm you. I'm just trying to go to the edge and back off, okay? The goal of treatment is like a physical trainer at a gym, right? If I overwhelm you, I never see you again. If I go too easy, then we didn't do anything. So we got to try to find the edge and then back off.
I'm just looking forward to going out in public with all the red marks.
Yeah, what happened to you? Honey, let's take the next elevator. This guy's got bruises all over his neck right now. Get out of the pool, kids.
It's that flesh-eating bacteria.
Bubonic plague's back. I read about it in the encyclopedia.
I could just go to Clearwater Beach and tell them, hey, the flesh is back.
Oh, it's
Bacteria. How much pressure is this?
Oh my! I'm saying this right here. This is the same pressure.
Oh no. I'm trying to figure out how bad, each
That's
part
how
of my...
inflamed it is. Yes, sir. Yeah, you got it. That's how much inflammation is sitting around the nerve in here. That's what's causing the contraction. The nerve is sitting in that much acidity. Yeah, right there. Oh, that's a nice lump. Yeah.
I'm not going to
Say
talk
it.
back to you.
No. Yeah, well.
I've never even squatted heavy a day in my life. I assumed this would all be muscle.
No, it's just the muscles are being tasered by the pressure from the discs, pressure on the nerves. Yeah, I gotta get all this.
Yeah, that's how the body just wants to run away from you, but I'm laying down.
There's nowhere to run. There's nowhere to hide. I think there was some video game ad when I was a kid. It was like, you can run, but you're just gonna die tired.
Oh, that's the worst.
Go ahead and run. You're just gonna die tired.
You know, if I could run while laying down, I think that would be a positive for my spine at this point. Maybe more mobility, in a sense.
I got you. There you go. Good. There you go. Right there. That's what causes it.
I can feel the adhesion on the left side, I think.
Yep. You got it right there. Right there. I can't even hardly stay on it. It's like a old knot, old stain. You put a couch over top of it and said, "Man, nobody will find it." And then I came digging and found this.
You put the couch right over all the dirt you didn't vacuum up beforehand.
That's right. Breathe for me, buddy. Breathe. Gotcha. All right. I'm just gonna hold it. It's okay.
Yeah, it's a bit painful on the
Breathe.
left side.
Yeah, I got you. Yeah, breathe. Just gonna hold. All right, we're holding. There you go. Okay, all right. Yeah, we just lost a lot of your bending back ability here. We're gonna stretch in a second. We're gonna put some devices here.
Okay.
All right, bring your arms up for me. Bring your head for me. Put your forehead around your forearms. I got you, bud.
On the form?
Please, if you can keep your forehead to forearm contact. I got you, bud. I got you. You relax your chest now. I got you. Exhale for me. Easy. Good. Breathe for me. Exhale. Good. I got you. One more. Breathe. Exhale. Oh, it's okay. Okay. Put your arms up. It's okay. Arms down. Breathe for a second. Breathe.
Okay. Well, that's new.
I didn't know those could move like that.
I really did it.
I got you. Mm-hmm. Relax your hip. Okay, very good. Press back again. It's okay. Yep, you're good. Relax. Go ahead and press back now. There you go. Yep.
Oh, you didn't even need to do anything.
I got you. Tilt your head right for me a little bit. Tilt right. A little bit. I got you, bud. Tilt your head to the right. It's okay. Your ear will stay on. I'm not going to take it off.
Yeah, thank you.
Not taking it off. I want my ears, please.
I end up with cauliflower ears after this.
Nobody's going to have Go ahead and tilt left.
Oh, that felt.
Go ahead and tilt left. Tilt head left. Okay, it's okay. This is the dental roll. This is the cervical dental roll, and I know you said you've been laying on maybe something somewhat similar.
Right, yeah, and I try to have it at about the same level that you have it right now.
Good, yeah.
I assume C3, C4?
As high as you can, really, even if it's up a C2, be fine. You're really trying to come right off the occiput, but it might slide down a little bit, but enough that your head's going over it, right? So your head, it's not just, like if you have it too high, that makes sense, the chin's down.
Yeah.
Right, I want it coming down a little bit so that your head is going over the device, but it's not so high that your chin's down and not so low that we're down in the valley of your lower neck.
Yeah. I learned this from your video, surprisingly, and after using it for about 20 minutes a day, I ended up having the shoulder feel significantly better for about an hour or two.
Yeah, because that lump on the right side, you can even do a little bit of right rotation, just a little bit. I got you, bud. I got you. Lay back for me. I got you.
Yeah.
There we go. I got you, bud. I got you. There you go. Knees bent for this one. Yeah, if you can do knees bent, you're fine. There we go. Put your arms to the side. Like, over to the side if you can. Like across there. You're trying to stretch your shoulders back. You're doing good. Now put the feet together, knees together, and then kind of rotate your knees left or right, either way. Yep, there you go. Stretch. Yeah, get that pressure on that side. I know. Got to start practicing.
So go about...
Well, eventually knees are on the ground, but you don't have to go so crazy, but go knees left now. Breathe. Exhale. Yeah.
Well, this side is,
A lot easier.
yeah.
Yeah, you got to work on that knot on that right side, right there. Yeah. Yeah. There you go.
Oh,
yeah.
I
yeah.
think that,
Yeah, you got what I was trying to achieve by lifting your legs up. Hey. It's okay.
oh, keep them
You're
together.
good.
I'm
No,
sorry.
you're good. Yeah, well, best you can. I mean, if it fall apart a little bit, it's fine. But yeah. Yeah. I mean, this is your retainer for the lower back.
Okay, that's simple enough for me. So after this visit, stick to 20 minutes per daily.
That's your goal. That's your
Okay.
goal. Like I said, the way I would do it is as deep as you can, and don't overwhelm yourself. First, make it easy. Let's make it to a place where maybe you don't feel like it's even doing anything. You understand? You can always make it deeper, right?
Mhm.
And then push yourself to a deeper level of stretching. And then ideas before you go to bed, half hour before you go to bed, is when you're trying to do these, trying to get your spine in the right position and then go to sleep.
Okay.